Hello, my name is Kiana Thomas, and for my internship, I did it at Rocking Armor Physical Therapy. And my project I'm focusing on is the implementation of blood flow restriction therapy, or BFR for short, in musculoskeletal rehab. So, for my project impact, it was to learn how to safely implement BFR and then understand how BFR can support recovery and outcomes. So BFR is performed using a tourniquet system, a blood pressure cuff, that can be applied to either their lower or upper extremities. It allows the reduction of arterial inflow and includes venous outflow during exercise or resistance training. It restricts blood flow to the muscles, which allows them to experience faster fatigue and oxygen depletion, which then recruits fast twitch muscle fibers more quickly. So first, when the BFR is applied to a patient, it will take the patient's blood pressure. Then afterwards, we're doing about 50 to 80% of occlusion. With the BFR, a helpful thing that it includes is that it counts the reps of how many of the a particular exercise a patient's doing, and then it allows a pacer to allow more controlled and smooth movements. Typically, with a lot of patients, they'll perform exercises quite faster than they need to. So allowing that pacer to, like for a single leg lift, being able to lift that leg for 2 seconds, hold for a second, and lower back down for two is very helpful. So here in the middle, you can see a leg, and that's the exact type of blood pressure cuff, or the BFR blood pressure cuff that we use at our office. And then the little stripe thing is just to protect the skin from the blood pressure cuff. And then up here to the upper right is the exact blood pressure, our BFR technology that we have in the office. So when we are trying to get stronger, we typically lift heavier weights, which the oxygen and muscles are depleted, and it creates metabolic cascade. The brain recognizes this, then sends growth hormones to that area to get better or grow bigger. In the case of a post-op ACL, meniscus, rotator cuff type surgery, we don't want to load them up with a lot of weight. So BFR mimics this without putting a lot of stress on the joints and allowing more muscle activation. So I came up with this topic was because I never heard about BFR, never knew about BFR before I came to this place. So it was quite interesting to see the recovery timeline on a lot of patients here. We focus a lot on high school athletes, college athletes, and more physically active individuals. And comparing that to a different PT clinic that I worked at that was a lot more acute. So my biggest takeaway, or what I've learned most from this project, was understanding which populations BFR would help with recovery a lot more. So again, we with this office we focus a lot on athletic individuals. So just comparing that timeline to again the other PT clinic, it was quite interesting to see. So typically we would apply BFR to high school and athletes, college athletes, more physically active middle-aged people. Typically, we don't want to apply BFR to an older individual that are in their 70s plus years of age. So understanding which populations would be more impactful with BFR was very something that needs to be taken into consideration. What I would do differently, I would have tried BFR on myself a lot more. When I first learned about BFR, I tried it on my knee just to get that feeling, but having more uh, opportunities to try it on my arms and other places, and even trying it through different exercises to actually feel how it feels and then seeing how that might aid with my own recovery would have been interesting to see. So my average day at my internship, interns do a lot of tech stuff. I'm fortunate enough to also be an employee here, so it's a typical day for me. So coming into the office, making sure that everything's clean from tables to equipment, putting away equipment, then doing laundry, doing electrical stimulation. But a main part of techs are to help put on modalities. So whether that's being boots, heat packs, electrical stim, ice, all that different stuff, and then being able to put it in proper placements of where the injury or what they asked for. And then of course, sometimes techs or interns will have the opportunity to work with a patient with a couple of exercises. So they would give us a list of exercises. So learning how those exercises should be implemented and just observing that and making sure that patient is safe. And then here you can see the different types of coursework that helped me with this project. And then the methods that I've kind of mentioned before. And then I believe that the BFR should have more research conducted on it to help support it in recovery. I would definitely continue with the physical therapy route. There's so much new technology, new things that people are learning about physical therapy that very much interests me. And there's so many different specialties that I'm starting to consider rather than, of course, sports physical therapy. So I found this opportunity great to learn, and I would love to continue down it and getting ready for PT school. But that is it, and I thank you for listening.